Go. Hi, I'm Jeana. I'm going to be your nurse today. I'm going to do an assessment on you, okay? I'm going to videotape this for school. Do you agree to be videotaped? Yeah? Okay. Alright, so I'm going to wash my hands first. Looking at your general overall appearance, your nutritional status, looking for any respiratory distress or any pain or anything like that. I'm going to look at your head, okay? So I'm going to feel your head for any masses, bumps, lesions, anything like that, any abnormalities. Does that tickle? Okay. Can you look at me? I'm gonna have you copy my faces, okay? Can you make a happy face? Make a mad face? Can you wiggle your nose around? Okay, that's testing cranial nerve number 7. Also, I'm gonna have you, can you clench your teeth together? Clench them, and then act like you're chewing something, and then swallow, and then can you open your mouth against? Okay, good. And that's testing cranial nerve number 5. Okay, can you look at me so I can look at your beautiful eyes? Okay, I'm looking at placement and symmetry, pointing at the inner and the outer canthus, and then I'm going to pull down on your eyes, okay? So I'm pulling down on the eyes, looking at the conjunctiva,
this close.
Looking at your sclera, and I'm going to go ahead and flash a light in your eyes, looking for reactive pupils. If you can look right at me. Good. Look right at me. Open your eyes.
It's just like snow.
It looks like snow. It's snowing outside, huh? Good. All right. If I had an ophthalmoscope, I would look at your optic disc and your nerves. I'm going to test your visual acuity, which is cranial nerve number 2. So if you can cover one of your eyes and tell me what the top letter is.
B.
And the bottom. Good job. Okay. And then I'm going to test cranial nerves number 3, 4, and 6 for extraocular movement. So if you can look at my finger and follow my finger. Keep your head still though, okay? Good, with just your eyes. Good. Okay. Now I'm going to look at your ears. Okay, I'm looking at the placement of them, the pinna, looking in the external canals for any discharge or redness, any abnormalities there. I'm going to go ahead and look inside your ear, okay? You can stay nice and still so I don't hurt you, okay? I'm looking at your tympanic membrane, looking at the color, looking for any redness or pus. Looking at the light reflex, and it's nice and gray. And then look at this one too. Okay. Looking over here. The same thing. Looks nice and gray too. Good.
See my nose.
And then I'm going to test your hearing, which is cranial nerve number 8. So I'm going to whisper something in your ear and have you copy it, okay?
Mommy. Daddy.
Good. Okay, now I'm going to look at your nose, okay, looking at symmetry, looking at your septum, and looking at the mucosa of it. Can you breathe in and out? Good. I'm going to put a light in there. So I'm going to look inside your nose, look at the color. Good. Look on this side. Good. Okay, I'm going to look at your mouth. You can go looking at the color of it, looking for any abnormalities, looking at fissures, and look at your hard and soft palate and your teeth. They look nice and pretty and white. Looking at your gums. Good. And then can you go looking at your tonsils. Good. And testing cranial nerve number 9, 10, and 12. Looking at your tongue and then your gag reflex. Can you put your tongue up to the top of your mouth? And then down, and then over to the sides of your mouth. Good. Okay. Alright, I'm going to test, also I'm going to test your sinuses. And let me know if it hurts at all. Your frontal sinus, your maxillary sinus, your ethmoid, and your sphenoid. Good. Okay, and I'm looking at your neck for any masses or deformities or anything like that. I'm going to feel for your thyroid. Good. your flexibility. Can you flex your neck down? Can you lift it up to the sky, extend it, and then can you look at me? And can you rotate it to one side? And rotate it to the other side? And can you bend to touch it one side? Yep, and can you touch the other side? Good. And then can you lift your shoulders up against mine? Good. Okay, and that's testing cranial nerve number 11. You can relax. Okay. I'm also going to feel for your lymph nodes, your anterior cervical, and your posterior cervical, your occipital, and your submandibular, your submental, your supraclavicular, and axillary, and tickles, and then I gotta feel right here, your inguinal, and that tickles too. Can I feel real quick? I know, it tickles, huh? Okay. And then I'm going to look at your spine. So I'm gonna put you this way. Can you bend over, like curl over, like a ball, flex your spine? Okay. Looking for any scoliosis, any abnormalities there. Okay. And can you extend back, like stretch your body back? Good. Okay. And then I'm going to look at your thorax or your chest. You can look up and just look for any respiratory distress, looking for equal movements in your chest. I'm going to go ahead and percuss your lungs, so I'm going to tap on your chest, okay? Good. Okay. Can you say 99?
99.
99?
99.
Good. Say 99?
99.
99?
99.
Good. I'm going to percuss your back as well. Okay. I'm going to listen to your lungs now. You can stay this way. There we go. Nice deep breaths. Okay. Now I'm gonna listen to your, I'm actually gonna feel your heart, and then I'm gonna listen to it, okay? So I'm palpating and feeling for any thrills or heaves or anything like that. Okay, so aortic, pulmonic, Herb's point, tricuspid, and mitral. Okay, and I'm gonna listen. Good. And the point of maximum intensity is nice and strong. Okay, I'm going to feel your radial pulses. Good. I'm going to feel your femoral pulses. Good. It tickles them. Okay. Alright, next I'm going to have you lay back so that I can look at your belly. Okay, pull your shirt right there. Pull it down. Okay, can you just lift your head up just a little bit? Okay, good. I'm looking for any hernias or any, you go ahead and lay your head down. Any masses or anything like that. Looking at the belly button, making sure that everything looks good. Okay, I'm going to listen to your aortic artery, renal, iliac, and inguinal. Okay. I'm also going to listen for your bowel sounds. So listen in the right lower quadrant, right upper quadrant, left lower quadrant, left upper quadrant. Okay. I'm going to percuss your belly in all those spots too, okay? So right lower, right upper, left lower, left upper, okay? I'm going to push on your belly, feel for any masses or any tenderness, any rebound pain. Okay, and I'm going to push a little bit harder. I'm going to try to feel your liver, okay? Palpating it. Can you take a nice deep breath in for me? And out. Good. Okay, I'm going to have you do the same. Take a nice deep breath in for me. And out. Feeling for the spleen. I'm also going to percuss to see if I can hear it. About 5 centimeters where your liver is, and then percuss for your spleen. Does that hurt at all? No? Okay. Alright. And then if you can sit up. Okay. I'm going to tap on your back and check for CVA tenderness. Does it hurt at all? Okay. Good. Alright. And then I'm going to have you come around this way. And the genital exam is deferred, but I would check for external genitalia, the appearance of the vulva and the hymen, any abnormalities, any discharge. And if rectal exam was necessary, I'd be looking for the sphinctal tone and any fissures, any hemorrhoids, anything like that. So we're going to go ahead and test your range of motion now, okay? I'm going to start with your hands. If you can flex your hands down and extend them up, and then your fingers, can you spread your fingers out, abduct them, and then adduct them, and then your thumb, can you abduct it, and then adduct it, okay? And then can you run it across your hand like that? Good, and then just twist it around. Good. Okay, and can you squeeze my fingers? Good. Now I'm going to look at your wrists. Okay, can you flex your wrists down and extend them up? Can you turn them inward? Ulnar deviation and outward. Ulnar deviation, radial deviation, inward. There we go. Okay. And then I'm going to check your elbows, your strength here. Can you push my hands up? And can you push my hands down? Okay. Can you flex, show me your muscles, and extend them out? Good. Okay. Now can you do supination, like you're holding a bowl of soup, and then pronation? Good. Okay, and then your shoulders. Can you push my hands outward? Good. And then push my hands in? Good. Okay, can you flex your arms up and extend them down? Good. And abduct them away, and then put one across, abduct it, and then put the other one across. Good. Okay, and then can you do external rotation, lift your arm up and down, and do it with this one, put it up and down, like that. Good. Then can you touch your back, internal rotation, and the other one with the other hand? Good. And then can you just twist your arms around? Good. Okay. Now look at your feet. Alright, looking at your toes, any deformities or any issues there. Okay, can you crunch your toes down for me, flex them, and then extend them up? Good. And then can you spread them apart? And then squeeze them together. Put them together. Good. Okay. And can you push my hands up? And then push my hands down. There. Okay. And can you do flex your foot up, dorsiflexion up? Here. Yep, point them up. And then can you point them down to the ground? Good. And then inversion and eversion of the heel. Good. And can you straighten your legs out, extend them out? Yep, and then flex your knees down. Good. Okay. And can you push my hands out and push my hands in? Good. And can you push my hands up? You can do one leg at a time. Good. And then push my hands down. Good. Okay. I'm going to check your reflexes. Okay, just relax. Can you sing me a song? Can you sing me a Frozen song? No? Okay. Can you relax your arm? Relax. Can you look up to the sky? Good. Okay, just keep relaxing. Look over at the letters. Can you tell me those letters again? Relax your arm. Relax your arm. Relax. Just let it go. There we go. There we go. Relax. 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 What do you want for your birthday?
A fruit.
What?
A toy.
Relax your arm. A toy? What kind of toy?
On a toy.
An Anna toy? Okay. Can you stand up? And hop for me. Hop on one foot. On the other foot. Okay, good. Can you walk? And then walk back. Walk back to me. Good. And can you touch your nose? My finger. Can you touch my finger? And then your nose. Your nose. And then my finger. And then with that hand, touch your nose, my finger, and then your nose. Okay, good job. And that's the end of this presentation.